constructed lions and all. What a sight. A zoo time they had there, people of Yola. But anyway, thank you, Anna, for that Kakaaki socials, aka Asa socials. Now, it's second Wednesday of the month, and of course, you know how we do these days, Kakaaki Cancer Awareness in collaboration with Cormode Cancer Foundation, and it's going to be the time to hand over the reins to founder and chief executive officer Dr. Denise Ejoh, who will be focusing on lung cancer. Good morning, Doc.
Good morning, how are you?
I'm very well. Over to you.
Is it summertime and that's why you're on your own?
Oh.
Good morning, viewers, and welcome to another edition of Cancer in partnership with AIT. My name is Dr. Denise Ejoh. Today we're going to be talking about lung cancer, the growing burden and the challenges of late diagnosis. Many people may ignore symptoms such as persistent coughs, breathlessness, or chest pain. The disease has progressed. So why are patients presenting late? What are the barriers? What are the barriers of early diagnosis? And what can we do differently? Joining me today is no other but Dr. Amadi. Well, let me put it the order is supposed to go. Dr. Christian Amadi, consultant Cardiothoracic. Gosh, I don't know how to pronounce that. He'll pronounce it himself. And Vascular surgeon at the University of Port Harcourt Teaching Hospital. Dr. Amadi, you are welcome to Cancer with Dr. Denise Ejoh. Here we go. How are you? Good morning. Can you hear me?
Good morning, Dr. Denise Ejoh.
How are
yes,
you?
I can hear you. Can you hear me?
Yes, I can. We're back. We're on. All righty. So I'm not going to waste too much time.
Fine, thank you. My name is Dr. Amadi Christian Emeka. I'm a cardio. Okay, so my name is Dr. Amadi Christian Emeka. I'm a cardiothoracic and vascular surgeon with the University of Port Harcourt Teaching Hospital and a lecturer with University of Port Harcourt. It's my pleasure being with you this morning.
Thank you very much for joining me. Together, this is all about all of you joining us for the first time. Welcome to our program. Sit back, relax, and let's get on with this show. Or let's get on with this fact. The growing burden of cancer. Let's start with this big picture. How serious is this burden of lung cancer in Nigeria today? And I may ask follow-up questions once you answer that.
A big disease with us, with humanity generally, and then in particular with Nigeria and Nigerians. You know, managing cancer has been a very challenging one for us. You know, looking at our economic status, materials, and facilities available to us, even the human resources in terms of specialists. So cancer has been a huge burden, you know, to us as a nation, and particularly lung cancer. Though, like the challenge we have with most other things in our country, statistics is usually an issue.
We've lost him. Port Harcourt network. Thank you. We're waiting patiently for you.
Hello?
We're back. Alrighty. Okay, you're back now. Come on then, let's go.
Okay. So.
It's okay.
So the records we have, which is about as 2020 from WHO, we have about, says that we have about
we can't see you.
Nigerians.
Good. Okay.
About 700 cases in Nigeria of lung cancer, and about 1,600 deaths yearly of lung cancer. That's to tell you how serious it is. Even with this, we believe that that records may not be true representation of what is on ground. Before now, we didn't have any data, but with the works, having more specialists on ground and the work we are doing at various, the record is improving.
So basically, we're accepting the fact that we don't have the data. You've just started the collection of data, and based on that data, the diagnosis in Nigeria of lung cancer is increasing or is higher than we really do know. Okay, so are there any particular misconceptions about lung cancer that you think Nigerians may need to understand?
Okay. Yeah, there are misconceptions. So in most cases, people see it as first and foremost as a spiritual problem. Like most diseases. When people have challenges, the first thing that we look at is spiritual. Before we now start seeking for help. Hello, can you hear me? No.
Yeah, no, I think that's a little better. Yeah, switch off your camera and your voice.
Sorry, I didn't get that.
Okay, you switched off your camera and your voice. So, do you want to retake that again? Are there any particular misconceptions about Nigerians?
Yeah, so there are misconceptions. One of them is
you have two devices. Can you switch off? Can you silence one of your devices? Hello?
So one of the major misconceptions is that like most other diseases in the country, when people have issues of lung cancer, it's seen as a spiritual problem, or that it's witchcraft, somebody has poisoned them or so, or has done something spiritual against them, especially when some of them all of a sudden see that they're coughing out blood. So instead of going to the hospital, you send going to patronize the spiritual homes, going to churches for prayer, going to the native doctors.
But when I say that, when you say that, for someone like you who lives in Port Harcourt, where are we going to put pollution? Because yeah, because that would be a very big, that should have a very big impact on
Sure. Generally, as well known, the main causative agent is smoking, but you also find it in non-smokers. And then the other thing is environmental pollution. You look at like those that live in cities, generally from exhaust pipes of cars and then is those in the Niger Delta, where we have oil, pollution, and then the issue of poorly refined crude, that generates a lot of soot into the air, and this is another big factor. We are thinking that is contributing to the rising figures we're having recently.
Yeah, I think we have to recognize that, because unless governments address that, no matter how much money you pump into cancer, if the environmental factors are not addressed, you're just going to keep bringing out more people with the disease, I think. Anyway, many patients only reach out to specialist care when the disease is already advanced. That is the thing. Now, you mentioned that it's to do with spirit. A lot of it will be to do with spirituality when they start coughing blood. But before they start coughing blood, why does this happen? I'm taking from you.
No, I don't understand the problem. Why does it happen?
Many patients, I'm looking at it from your starting statement about the spirituality thing, this spiritual, that they will wait until they are coughing blood. So many patients only reach specialist care when the disease is already advanced. Why does this happen?
Good. Because most of our questions, why does it happen? One, at the initial stage, generally the lung cancer may present problems in our environment. We have health habit. Now, when patients start some people will tell you that it's normal cough, and most persons, or many of them, will not do anything about it until it now progresses to maybe difficulty with breathing, chest pain, coughing out of blood. That's when they appreciate that, oh, there is a problem. And even at this time, some persons, instead of going straight to the hospital to seek for help, they will rather go to the churches or to seek for help from the native doctor. It's only when that fails. In fact, some people present to the hospital at the point of death. And some persons have this misconception, for most illnesses, without a cancer not being an exception, that it is not something that should be treated in the hospital. They go and continue with prayer and fasting and all the rest of them. Then when the person is at the point of death, that is when the spiritual healer will now say, okay, oh, you cannot go to hospital. And they come to hospital and end up dying because of our presentation. They expect us to perform miracle. By then it's already late.
Yeah, I do understand that, because
that is one factor. Then the other factor again is sometimes some persons even present early. You also have challenges with the health system. Some challenges. Now the referral system is also been seen as a challenge. When they present early to the first responders or the general practitioners, who will see and may not recognize it as lung cancer. May think maybe it's tuberculosis or just a pneumonic process, any other bacterial infection, or even viral, and they will be managing it as such. Sometimes we've seen cases where a patient that had lung cancer have been treated over and over for tuberculosis for 3 months, 6 months, before finally presenting to us. So these are also challenges.
That's interesting. Okay, because I live in England, and one of the things I found was that once a case like this starts early, there's always a question. There's always this thing, question mark CA. I've now learned people's lingo. Question mark CA, and I found that nowadays, when even I talk to people and they give me that statement, I go and ask your doctor to do question mark CA, because if you do question mark CA and you get a result and it's clear, then you are in a better place to understand than for you to wait for question mark CA, and by that time it's already too late. Anyway, what should Nigerians know about the warning signs now and their risks factors? What should they?
Okay, what Nigerians should look out for? The truly you don't have signs that say this is, immediately you say it is automatically lung cancer, no. But first and foremost, we should have that high index of suspicion. This our mentality of it's not my portion, it's not my portion, it's not the best for us. You can remind, like what you said now, if a patient present to the hospital, the doctor is telling the patient, you may have cancer. It's as if you are putting the curse on the person, Instead of looking at the worst case scenario and pursuing it to make sure that if it is, you get it early on your treat. So when the person start having cough, and that cough is becoming protracted, you are taking medications, the cough is not resolving. Then you have chest pain, you have coughing out blood, or there's difficulty breathing, or there is recurrent episodes of chest infection, or what's as pneumonia. When it's occurring repeatedly, we should suspect that there may be something underlying. It may be a lung cancer, and then start early, present early to the specialist. Let something be started early. If it is picked up early in the early stages, stage 1, stage 2, the chances of cure is very high. But when the person comes at a very late stage, it becomes difficult. At that point, it becomes lots of more palliative care.
Yeah, and I think viewers should please note there's a statement that you've made, and I keep trying to get people to get it. Cancer is an everyday disease. So there's just having a cough can be cancer. Just having a cold can be cancer. Just having a headache can be cancer. So please let us not take this for granted. Okay. So with that in mind, rather than waiting for the problem, I'm going to ask you to give me one thing for the government, one thing for a patient, and one thing for the NGOs to do to help to reduce the cancer issues in Nigeria. So give me one statement for one thing the government should do for us, one thing the NGOs can do to help, and one thing patients or Nigerians as a whole should do to protect themselves.
Okay, for the government, I would say that improvement in our economy is going to help a lot, because many persons don't come to hospital because of fellowship. They go to some of these places because when they think of hospital, they are afraid. If cancer, lung cancer, can be made part of the NHIA, it is going to help. So if the economy is improved generally on one side to increase the purchasing power of the citizens, that they can get what they want, they can pay for some of the services on their own. And then again, closely related to it, if cancer can be made part of NHIA, that is going to help. For the citizens, I want to say that we should improve on our health-seeking habits. When there is an issue, quickly go to the hospital. Like I said, many persons will say that, it's not my portion, it's not this. When we have problem with our car, we go to the mechanic. But when we are sick, instead of going to the hospital or going to the doctor, you want to go to the spiritualist to pray for you. Why not take your car to the spiritualist to also pray for you, so that good care of your car and some other things around you? But when it comes to your health, you joked it. So health-seeking habits should be improved on. And then for the NGOs, I want to commend you what you are doing, and then if others can also join. The awareness is key. If NGOs can help in creating more awareness, because even the AIT we are now, not every Nigerian can afford to even see it. Those in the rural areas don't have this access. If awareness can see them, that would be great. So thank you so much for what you are doing. And then if NGOs can even take part of the care, those that can afford it, if they can take up part of the cost of care, somebody can decide to help, and NGO can decide to advance, maybe say diagnostic, even if it is 100% able to do.
But thank you very much.
Thank you so much.
Thank you for joining me today and for helping understand the growing burden of lung cancer and importantly the challenges. I know you've had network challenges, and thank you for staying. And to those of you watching, there are several messages that I'd like you to take away from this. Where there are risk factors in other areas. Secondly, do not ignore persistent coughing or unusual symptoms. That is one of the things. Loss of breath, loss of weight, chest pain. Just be aware, those can be an early presentation. You have a survival rate that is better. Finally, I'd like to say, please always seek a specialist, not the spiritualist. Dr. Amadi, thank you for joining us. Cancer awareness is not about creating fear, it's about creating health. So to all of you watching, support on Common Cancer Foundation, and you can also see what we're doing going forward. Have a lovely, lovely week, and I look forward to see you all again in 2 weeks' time. Thank you, Doc. It was nice meeting you and seeing you online.
Thank you.